This video is about pelvic organ prolapse. So this is a condition that affects around 1 in 7 Australian women in their lifetime. So it's a very common condition, and you're more likely to experience prolapse if you've had any babies. And the main symptom that women report with prolapse is a sensation of heaviness or a bulge or a lump inside the vagina, like something coming down in that area. Other common symptoms are urinary incontinence, difficulty emptying the bladder, a feeling of urinary urgency all the time, and difficulty emptying the bowel as well, so symptoms of constipation or incomplete bowel emptying. Some women experience a sensation of obstruction with sexual intercourse as well, which can be really uncomfortable. And some women experience dragging lower back or abdominal pain. So this is a tiny model of a human pelvis with the pubic bone at the front, the tailbone or coccyx at the back down here. So if you were standing with your hands on your hips, then they would be around this level up the top here. So you can see that there's a hole at the bottom of the pelvis. And usually, if everything's functioning well, your pelvic floor supports the pelvic organs that sit inside this hole. The organs are also supported by ligaments or connective tissue, but generally you need both to have the organs in the right position. So if your pelvic floor is weak or is not functioning well for a period of time, that will put stretch on the connective tissue that's supporting the organs from above. So for example, if you had a traumatic delivery where you had lots of tears and stitches after childbirth and you couldn't activate your pelvic floor well for a period of time, maybe for several months or even years, then your bladder, which is sitting up above the pubic bone here, is vulnerable to coming down and starting to press onto the vagina. So then you would experience things like feeling unable to empty your bladder or feeling that pressure in the vagina or discomfort with sex. So this is another way of looking at where the muscles are. So this diagram is looking down into the pelvis from above, and that's the pubic bone at the front, and here's the spine at the back. So you can see it's like this complex network of muscles that are filling in this whole area, and you can see also the urethra, vagina and anus or rectum are passing out through those muscles. If you look up between the legs, you can see urethra, vagina and anus again, tailbone, pubic bone up the top, and you can see there's another layer of muscle on top of that deeper layer which is also providing support. This is another diagram of the pelvis, this time showing it from the side. So this is the pubic bone at the front and the tailbone at the back. You can see the bladder, the uterus and the bowel sitting up above this red line, which is the pelvic floor muscles. So any one of these organs, or a combination, or all three, are vulnerable to moving down if the pelvic floor isn't supporting underneath. So physiotherapy is really important if you have a weak pelvic floor or a pelvic floor that is too tight, to help you learn to relax and contract that muscle so that it's providing as much support as possible to these organs so we can protect the ligaments and prevent further damage. In our experience at our clinic, we've found that women fall mostly into 2 categories when it comes to pelvic organ prolapse. Some women are too weak and lax in the pelvic floor so that the muscles are too long to prevent that stretch and damage on the connective tissues from above. The other group of women have a very tight pelvic floor, and sometimes this is in response to a prolapse because their bodies feel that pressure coming down from above and the pelvic floor is tightening up as much as it can to try and prevent that pressure. You might think, well, that's great. Muscles are tight, protecting the ligaments. However, unfortunately, a too tight pelvic floor can lead to symptoms like unable to or very painful sexual intercourse. It can pull your hips and pelvis out of alignment, can change the dynamics of your breathing. So with your diaphragm and your pelvic floor not moving well together, you can then get pain in your rib cage, pain in your tummy. So it's not an ideal situation to have a pelvic floor that is always switched on at its maximum capacity. So how do we treat pelvic organ prolapse as physiotherapists? Well, first we take a comprehensive assessment and a history. So we hear about when your symptoms started and what seems to aggravate them. We take a gynecological and obstetric history to understand how factors like a vaginal birth might have contributed to the development of a prolapse. We then talk to you about what you want to achieve with your body. So if you want to go back to running and high impact exercise, you may, for instance, not everyone, but some women benefit from using a pessary in the short or long term to prevent further support to their organs. Some women need to build strength and endurance in their muscles, and so we prescribe exercise that's specific to you to help meet those goals. If your pelvic floor is overactive and you're not breathing properly because of that tension at the bottom of your pelvis, then we'll work on breathing re-education and sometimes muscle releases to help the pelvic floor lengthen completely before it contracts. We're also looking at whole body movement and posture. So it's quite common that people with prolapse will have a very tight and twisty rib cage, which means that they're unable to generate enough pressure in the pelvic floor to support the organs. In some cases, there's no direct injury or trauma to the pelvic floor, but you might, for example, have had a hip injury, and because the pelvic floor muscles run from hip to hip, that has changed the way your pelvic floor functions, and that's led to having prolapse symptoms. If you're still struggling to understand the concept of how this all happens, imagine a Swiss ball in the middle of the room, supported to either corner of the ceiling by some stretchy elastic bands. And so this is like the Swiss ball is your organs, the stretchy elastic bands are the connective tissue. If I'm standing underneath the ball and supporting it from below, like your pelvic floor muscles do, then there's no strain on those elastic bands. But if I move away for some reason, and then a strain comes down onto the ball, it's really going to stretch those elastic bands, and over time it's likely that they'll tear and break. So some women will report a sensation of like a pop, doing something like a heavy weight at the gym, or maybe forcefully closing the car boot or something like that, sometimes having a bowel motion soon after having a baby. But more commonly it's just over time there's more strain on the ligaments because of that lack of support from underneath. And so if we go back to that Swiss ball elastic bands idea, if you have one side of the elastic band break, then that's going to allow the ball to drop down. If another elastic band breaks, it's going to drop down further. So that's how prolapse can progress and get worse over time. For some women, surgery represents the best outcome in managing pelvic organ prolapse, but it's always best to try the conservative management approach first, because all the conservative management that we do, so exercise therapy, activity modification, vaginal pessaries, all of that is reversible if it's not working or if it's not helping in any way, whereas surgery is permanent and it can't be reversed. So if you have any questions about this video or you'd like to speak to one of our women's health physiotherapists, please get in touch via our website or the number below. Thanks very much.